好，观众朋友们，大家下午好。今天是11月14号，转眼2021年1月份已经过了2周了。今天是礼拜四啊，今天很准时。只有 Andrew Dix 和 Andrew Bonnie Henry 也来了。昨天是519个新增，今天看看是多少。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right
自我介
is
绍
Dr. Bonnie
是
Henry,
我们
BC's
的卫生厅
Provincial
厅
Health
长，
Officer.
然
It's our
后
COVID-19
Bonnie Henry
briefing
是
for Thursday,
首席医
January
官
the 14th. We're honored to be here on the territories of the Lekwungen-speaking people, of the Sangis, and the Esquimalt First Nations. You'll note, and I think it's just been posted or being posted, our weekly report on outbreaks in long-term care, assisted living, and independent living sites should be posted at the BC CDC website. Tomorrow, Friday, there'll be a written briefing
明天
posted
是书面的。
approximately
那
3
么他
o'clock,
刚才
and
也
we're going to
提
be
到
aiming
了，就是我
for
们
that
BC
tomorrow.
省的这个长期护
At
理院
3
的
o'clock,
爆发的
and then
名
on
单
Monday
和
we'll
更
be
新
again
的情
briefing
况
from the。
那么也
press
请大
theater
家
here in
单独
Victoria,
看
Dr.
这个
Henry
BC
and myself.
CDC 一个
And
网
with
站，
that,
单
it's
独
my
看出
honor
来
to
的。
introduce
那么
Dr.
礼
Bonnie
拜一
Henry.
也是他们到这个新闻简报室做简报，明天是书面啊。好，
Thank you and good
关键的
afternoon.
时候到了。
Today, we have 536 new cases diagnosed with
536
COVID-19 in British Columbia, 6 of whom are epidemiologically linked cases,
6个是疑
bringing
似。
our total number of people diagnosed with COVID-19 to 59,608. Of the new cases, 102 are people in the Vancouver Coastal Health Region, 253 are in the Fraser Health Region, 21 people are on the Vancouver Island Health Region, 115 people are in the Interior Health Region, and 45 are in the Northern Health
好了，各个
Region.
卫生局的
We
数
now
字
have
都新增。
4,624 active cases, of whom 362 people are in hospital, 74 in critical care or ICU. Additionally, there's about 7,303 people under active public health monitoring, and 52,605
52,000多个已经
people
痊愈了。
have recovered from COVID-19. In the last day, we've had an additional 7 people in British
7个
Columbia
死亡。
who've died from COVID-19, bringing that total to 1,038 people in
1038
BC.
个死亡总数。
As always,
啊
we，
这
think
个
of
也
those
是
families,
致以诚挚的
the
哀悼。
caregivers,
那么
care
322个
providers
住
in the
院，
communities
74个
that
重症监
mourn the
护啊，
loss of 7 more of our seniors and elders.
也
Our
是
thoughts and our
老
prayers
年
are
人。
with
他
you.
说，老年人主要是老年人，年纪大长辈。
We have 2 new healthcare
又有
outbreaks
新的
at
2个，
Brocklehurst Gemstone
也
Care
是这
Centre
个
and Maple Ridge Seniors Village,
一个是
and
长期护理院，一
2
个
are
是
now declared over.
2个官方宣布结束，2个新增爆发。
A Laleham outbreak here on Vancouver
一个是
Island
急
and
性
the
线诊疗
Veterans
所，一个
Memorial
是
Lodge
长期
as
护理
well.
院。
That leaves us with 52
那么现
active
在还是
outbreaks
有
in long-term
52
care and
个
assisted
在爆
living
发，
and 12 in acute care units.
然后12个急性性急诊性诊疗所在爆
1,454
发。那
residents
么
of
其中呢
long-term care and
1400多个是居民
776
700多个是
staff
职员
now with active
，776个
cases.
是职员啊。
Since the start of our immunization program,
免疫人数。
up until yesterday, we've immunized 69,746 people in every health region and some very remote communities
那么到
across
昨天为
British
止是
Columbia.
69,746
Right
个。
now, our focus, as we know,
疫苗。
is on those who are at highest risk. And we are tracking and
那么大家
reporting
说
on
主
this
要还是
daily,
对
and
这高风
we
险
are
高风
building
险
a
人群
dashboard
进
that
行
will
施
make
打
this
第
more
一针。
available in some detail for you
那么
as
会
early as
对
next week.
这个我们这个
As our
会
supply
给大家有一
increases
个
and
疫苗
immunization programs
的施打
expand
的一
to
个
more
跟
and
数
more
字更新具
people
体数据
in the
给大家
province,
分享。
this process will
那么
become
随
more
着这个
complex
疫苗的到货的越来越
and more
多，会
challenging for all of us. And I'm very
更
pleased
多
that
的人
Dr.
去
Penny
施打
Ballum, as we
我
mentioned
们现在
yesterday,
还是
has joined our BC
很困难的就
immunization
是这个情
team
况。
as the
那么现
executive
在
lead
呢，
to
我们这
support
个
the
免疫
scaling
的
up
团
of
队呢，
efforts
现
that
在
we
又
are
有一
going
个
to
新的
need.
同事来
I know many people
增
are
强
also
我们的力
wondering
量，来
about
增
when
加
they
这
will show
个
up
供货
in the
要货渠
vaccine
道以及部
access
署的这个
column.
任
And
务。
we have put out some details about Q1, so between now and
那
the
么
end
现
of
在为止
March,
呢，在
the
第一季度之
people
前
most
的
at
施打
risk
的
and
计划
people
呢，
who
我们
are
会有比较
supporting
详
our
细
healthcare
的计划
system
了。
are the
这个
priority,
是
and
比
we are
之前
working
粗犷的
on
更加详细，
giving
因为
detailed details
经知道
about
了到
everybody
货的
else,
情况，
starting
所以
when
慢
we
慢
expect
开
to
始
see
就会给大
additional
家详细的
vaccines starting
计
in
划数
April.
据。
And we will be providing details
所
of
以我们会给
that
大家
next
详细
week.
的
So
下个礼拜开
please
始
be patient.
请大
We
家耐心
have
等候。
a lot of considerations
所
that
以
need to
我
go
们已
into
经考虑
this.
了很多的
We're
因素，
still working on the issues
但
of
是我们
how
还要
much
进一步完
vaccine
善。
we expect to receive when.
我们还要知道
But we will
到
be
底需要
having more
有多
details
少疫苗
provided
还我们
in
预
the
期到
coming
达，
days.
所以这个是请大家稍微耐心一下，下个礼
Also
拜会
want
给
to
大家详细的。
talk today about the new variants that we have seen here in British
那
Columbia.
么现在还可以报告
As
大
you
家，
know,
我们
there
现
are
在
a
又
number
发
of
现2个
COVID-19
新的
variants that have
变种
arisen around the
病
world
毒
that
变异
have
大
caused
家都知
increased
道这
concern,
个
and
现在
we are
全世
paying
界都
close
在对这个
attention.
病毒变
We
异
have been screening,
我们告诉
doing
大家，我们
random
省也是
samples
在积极的
of
筛
some
查
of the
我们在随
isolates
机
that have
在
arisen
看
and。screening
那么
as
上次
well
说
on
到了
people
英国的
who
变异呢，发觉不
have
多
traveled.
这个也是
And
跟
we
大家
now
说一
have
下。
4 confirmed cases
那么
of
现
the
在有4个
UK
确诊案例
variant
是
in
英
British
国的变
Columbia,
种，
3 of whom are linked to one specific
是一
traveler,
个是3个都是
and
从一
one
个里边传
related
过
to
来的
an
这个也
additional
是
traveler.
源头，就0
There
号
are
病人
no
是一
other
个。 那
contacts. We
么
don't
这也是
believe
特殊
that
的
this
一个
has spread
旅
at
行
all
过来的，
from these
有旅行史的。
4 cases. In addition, in the last day or so, we've also identified our first case of the South African
那
variant
么还有一
of the
个是昨天
COVID-19
呢，我们又确诊
virus.
了
And
南
this
非的一个变
is
种。
in a person who has not known to be to have traveled
那么
or
他
to
没
have
有旅
connection
行
with the
史
traveler. So
他
we are
或者
still
也没有跟旅行
investigating
相关的人接
where
触
this
过，
person might have contracted
所以
this virus.
他可
And
能
that
是也是
will
从其他地
continue.
方接触过
It
来，
is of course
所以我们还要
concerning
积
that
极
we
的
don't know
去
where
接
this
触跟踪
arose.
接触者。
However, at the moment, it does not appear to have spread in the
那么
community
目前为止，我们没
beyond
发
the
觉这
person
个
that
变
we've
异南
identified.
非变异病毒
Both
在社
of
区里
these
边
new
传
cases,
播
the fourth
这2个变异的病
UK
毒
variant
的
and the
事
South
件
African
包括
variant
英国的
are
和南非
identified
的
in people who live in the
变
Vancouver
异
coastal
病毒
health
呢
region.
都是在我们都找到
As you know,
都
we
是在
do
温
have
哥华沿
concerns
岸
that some
卫
of
生
these
局下
variants,
的
particularly
那
in
么
the
大家
UK,
我们也
may
知道了，
allow
特
the
别是
virus to
对英
spread
国
more
病毒
easily.
特
And
别
that is
重
why it
视，
is important
所以
for
我
us
们
to
不希
continue
望
to
因为它
monitor
英
and
国
to
病
do
毒
the
变
whole
异
genome
的病毒变异
sequencing
呢特
that
别
we've
容易
been
传
doing
播。
in terms of surveillance for
我
these
所以我们在
variants.
积极的跟
It's
踪接
also
触
why
和
it
观
is so
测，
important for
所
all
以
of
也
us
请
to
大家提
continue
高
to
警
take those
惕，
measures
也是
to
要
prevent
额
the
外
spread
的
of
引起重视
COVID-19.
不要
That
放
means
松，要
not
各种措
gathering.
施，
It means
也避
keeping
免
your
这个
contacts
聚
small,
集。
making sure
那么
you're
大家呢
using your
就算要集
protections,
结人员少一
following
点
and closely
那么
monitoring
多一些
your
卫生
personal
措
health.
施预
And if
防
you。have any
然后
symptoms
呢，自
at
己
all
的
of
自己的
concern,
健
to
康
make
状
sure that
况、
you
自
get
己的
tested.
症状都要密切注意、关注。
I have spoken many times before
我也
about
说过
how
了
we
好多
are
次之
in
前
different boats,
啊，
how our experiences are unique through this
因为
pandemic,
我们这次
even if
的
we are all
全球
in
流
the
行
same
病
storm.
是对我们
Here
来
in
讲
British
都是
Columbia and
前所
around
未
the
有
world,
的。我
we
们
have
省
far
和其
more
他的地
in
方也
common
不一
than
样
when
啊，
what
所以我
separates
们的
us
经
when
历
it
都是
comes
独
to
特的，所以
COVID-19.
我们一定要
We are all
区分清楚
susceptible to getting ill from
我
this
们一
virus.
定要对所
And
有
we
的
all
事
have
情都有
choice
所
about
警
our daily
惕，
activities
不要放
and
松
how
警
we
惕
treat。
那
those
么我
around
们
us.
一定要对自己每天的活动、行动呢
COVID-19
都要有所
doesn't
考虑
But systems
我们要知道
do.
这个病毒就在我
And
们
it has
身边
illuminated
如
for
果
us
我们的这个
many
系统就是要
long-standing
让我们
inequities
要
in
长
different
期
parts
的
of our
与这个
society.
病毒在斗
It has
争
also highlighted
使得我们
how
就算
First
我们
Nations,
社会的
Métis,
各个
and
阶层
Inuit
在各个
peoples
角
in
色
British Columbia
都要
did
考虑
not come
清楚
into this
那么尤
pandemic
其是这
on
些
equal
原住
footing.
民等等他们
Recently, I have been very
都是对
saddened
这
and
个病毒
disturbed
特
to
别
hear
容易受
reports
到
of
攻击
discrimination and racism that is
那
counter
么
to
我
the
们也不
kindness
希望
and
看到
compassion
大
that
家
we
由于这个
expect
病毒产
and
生
have
各种
seen in
仇
British
恨
Columbia
也是
from
对这
so
种种
many
族歧
people.
视 我们不希
In
望看到
particular,
这
members
个。
of the Cowichan tribes here on Vancouver Island
我们也
have
已经
been
看到了我
stigmatized
们
and
BC 省
discriminated
很多
against
人
as a
都
result of
鄙视这
COVID-19.
种歧视行为，对这
I'm
种
pleased to receive
那个
reports that the tribes
这种犯罪
themselves,
行
First
为或者
Nations
是
Health
怎么样，都
Authority, the local island
体现
health
出
public
很好
health
的
teams,
精神状
as well
态。
as many
那么
others
特别是
have
呢，
responded
我们
quickly
也要
and
我们省呢
collaboratively
对
to
这个原
support
住民
those
以
who
及他们
have
的社区
COVID-19
的也是
and
额
who
外
are
的支持，
self-isolating
会给他
and
们
caring
额外
for
的
each
帮
other.
助对他们也是让他们隔
This
离呀
type of
提供
racism cannot be
帮助啊，
tolerated,
维护
and
啊
I stand
爱
against
关
this
怀，
with
因
my
为他们
colleagues
这个都是
to
在
say this must
偏远地
stop.
区
On Vancouver
医疗
Island
基础
and
设施
elsewhere,
都比较落后。
racism has no place in our society,
那么
in our
同时在我们
communities
社
here in
区
British
这种
Columbia.
种族
And we
歧
must
视在我们
all
省
take
在
the
我们社
time
区是
to
没有
speak
市
up
场的
and speak up.
不要再考虑这种事情啊。
The health challenges that
那
come
么
with this
同时
virus
呢
are
对我
difficult
们的
enough
公卫系统
without
的这
also
个
having
挑
to
战
face stigma
困难
and
也是已
discrimination
经
from
前所
those
未有
around
了。
us.
所
We
以
must
我
go
们
beyond good
一
intention
定要
and
继续
each of us
一
find
定要相互
opportunities
那
to
个
take
支持
anti-racist
相互的
actions.
帮助。
The Northern Health
那么
Indigenous
我们
Health
不
Page
要
and
给
National
这个
Collaborating
反
Center
种
for
族给种族
Indigenous
主义
Health
者
have
有任
developed
何
a
的机
short
会。
animated video
那么
that
特
I
别是
encourage
我
all
们
of
也要
us
尊重原
to
住民
watch.
今天他
This
提
video
到了
called
原住民
Healing
很
in
多
Pandemic
不
Times
知道是什么意
speaks
思。
to the
那么我们也
challenges
拍了
that
一些视
Indigenous
频
peoples face
那么
and
也是
have
告诉大
faced
家怎
and the
么如
role
何
we
面
all
对
play
正
in
确面
helping to
对
address those
这个面
challenges.
对
It's
这个病
available
毒
on
所
the
带来
website
的
of
困难
Northern Health
挑战。
and
我们
is
也单
also
独的
will
网
be
站。
available on the BC
所以
CDC
我们
website,
BC
and we'll send
CDC
out
有
a
很
link
多
to
的
that
资
as
源
well.
可以给大
Please
家
take a few minutes to look
你
at
们可以
this
花点时
today.
间去
This
看一
is
看。
one step that each of us
这个
can
只
take
是一个
today
每个人做
towards
快快一
ending
小步
racism
几分
and
钟都可以
having
看
an inclusive, supportive
那么大家都能
community
够考
that
虑
we
周
all
到
want
都能参与
and
进
all
去
need.
相互支持使得我们
During
的
this
社区
pandemic,
都需
our
要你们这
strength
么去做
as a province
那么这
has
个
been
全
all
球
of us
流
working
行病呢
together
已
to a
经使
common
得我们
purpose
能够
to
更
do
加
all we
紧密
can
的
do
团结
to
起
keep
来
our loved
让
ones,
我
our
们共同的利
communities, and
益
ourselves
共
safe.
同的目的保护我们的社区
COVID-19
保护我们
requires that
所
while
爱
we
的
stay
人
apart, we
这
must
个
find
安
ways
全
to
的
safely
面
connect
对
and
疫情
promote
需要
a
我们
spirit of unity,
同时
compassion,
相
and
互
support.
配合不是说
Using
你
your
做了
layers
我
of
不做了
protection
对吧
helps stop
就
the
算
spread
你
of
们隔离
COVID-19,
也要相互连
and
接
your
起来
individual
用我们
efforts
一
and
层新的
actions
措
can
施
help
保
to
护大
stop
家
racism and discrimination.
也
That
一定要
also
摒
needs to
弃
start
种族歧
today.
视我们一定要
COVID-19 is our
包括其
shared
他的歧
challenge,
视
and one we will only get through
所以
by supporting each other.
我们只能
We
相
face
互
these
支
new
持才
challenges
能共
every
同
day,
度过
but
这个
there
困难
is an end in sight now.
那么我们已经看到了
No
这
matter
个胜
where
利的
we
曙
are in the
光
province,
马上就要
choose
胜利
unity
了
over division. Take a few minutes
所
to
以
learn
大家
about
就花
healing
点
in
时
pandemic
间
times.
能够到我们
And
这
as
个网
always,
站来看一看
remember, we will get
我
through
们如
this
何
by being
这
kind,
个避
being
免
calm,
和这
and
个
being safe.
这个反对这个歧视，包括种族歧视。那么接下来它也是3个 ：be kind, be calm, and be safe 就是这样。要容让、容忍
Thank you very
以
much,
及
Dr.
这个
Henry,
安全、
and
安心。
wanted to start
那么
by
卫生厅长
expressing
又做了一些
my
指
condolences
示，他们也
that of
是
the government.
代
I
表
think that
厅
of
长和
everybody
他
in
本
BC.
人对这个
to
过
the
去
families,
24
the
小
friends,
时
the
死亡
caregivers,
7
the
个人的
communities
家
of the 7
庭
people
表示诚挚
who
的哀
passed
悼
away from COVID-19
他也是
in
说
the
每次
last
说
day,
到了
6
你
of
们
them
的巨大的损
lived in
失
Fraser
我们都
Health,
听
and
到
one
了。那么
on
他也是说
Vancouver
到了
Island.
是6个是在
This is,
飞沙
I think, an
1个是在
extraordinary difficult
岛上
to be
7个人
dealing with
6个是
issues
在
of
飞
grief,
沙。
especially
那么现在我再说一
in
下
some of
过去
those
24小
cases
时里
which
边
occurred
是新
in
增了
long-term care
536
homes
例
in the
那
Fraser
么
Health
其
Authority.
总数就到了
We are
59,608 例了
with those families and
各个
thinking
卫
of
生
them
局
today,
的
and our
新增
hearts
呢
go
我
out
都
to
记下
all
来
of
了
them.
唯一的我
wanted
刚才没有听清
to
楚
note,
住院是352还是
in our healthcare
322
system
我不敢
today,
相信是322
in terms of
我
our
希望
bed
是
capacity
322
on
那
the
么
acute care side,
这个他也
we
说
are
了
at
现在重症监护
89.9%
74个里
of
边
base
有
beds
多少
and
那么现在占床率是多
71.1%
少
of overall beds
80%
filled. Typically, this time of year, it should be understood that that number is
那么现在
100%
还
base
是
bed.
上次也是说
So
过了 这个
we
住
are
床率
continue
包
to be
括
in good
了
shape
重
in
症
terms
监
of
护
beds,
的占用
although
率
the stress
是
in parts
紧
of
张
our
一点
our
但
acute
没有
care
到
system
了很严重的地步 所以他刚才也说了
very
是
much
在
there,
good
and
shape
tell that
我们现在
by
还是在 good
speaking as I
shape 当
do
中
regularly to people working
所以
in the system.
那么
In critical
工作人员
care,
包括所有的医护人员
77.8%
都是在
critical care beds are
紧张
currently
有序
full.
的在这个
Those are
工
the
作
base beds.
那么 同时我们的常用的病床呢，现在是占有77%占用率，好像比上次汇报多一点嘛这个里边他们的这个病床占用率各个分布不清楚一会儿是56，一会儿是70几那么它也是各个卫生体，那么主要是北部上次说过了，北部的 紧张比较多占用率比较多一点，比较紧张。大家都可以看到每天新增都是北部都是45175、7396因为他那边的人就这一点反而新增那么多飞沙呢反而下来了。飞沙的是大温地区乃至 BC 省飞沙卫生局是人员最多的。那么这个，所以他们的新增的数字多也是正常。但现在看来，这个比例上来讲，北部反而多。
Have guessed, new vaccine has arrived.
那么大家也说，他也说到了，就是这个新的疫苗又来了，新的一批。
doses of Pfizer.
昨天来了，辉瑞是25000支。那么这个周末之前又要来，那么所以使得我们可以继续给更多的人去施打。主要是目前主要是关注在这个长期护理院以及协助式的这个居住的地方
and other vulnerable groups, and in particular,
特别是那些这个需要额外的关注，他们特别是脆弱、特别易受病毒攻击的。
I'd note that.
那么还有呢，他说这个农村的和偏远地区呢，因为上次Bonnie Henry医生也说过了，主要是给用那个Moderna呢疫苗呢，主要是储存方便不是相对辉瑞来讲那么同时呢，他也提到了2021年择期开刀的情况，也要有些是延后，有些是取消，有些是要恢复。那么同时也说到了这个2021年第一个礼拜，上个礼拜已经开了多少刀。
In addition, I'm happy to report that in the period over the Christmas period,
那么同时他现在说的是圣诞节的这个12月21号到1月3号之间那么完成了6800多例手术
to January 3rd, and that is 595 more surgeries
那么这个比去年同期是多了595例，就是前年比前年，因为这个是去年的。我们说从去年的3月21号到1月3号，那么应该是到前年。那么同时呢，也是说到了这就是跟踪接触的团队，那么现在已经又额外招生了13个人，所以现在是1326个。原来呢是说好500个，那现在远远也超过了这个数字。原来是计划招500个，现在是1326个。
Around whether these will be accessed.
那么我们现在还有369个候选人员在谈，因为他们还要面临这个培训等等。
I want to thank everyone doing this work, and the addition to our existing teams of 1,326 people shows our commitment to that work. I think the Premier talked today about our Health Human Resources initiatives to support senior services in BC, and that is of 3 components, adding up to a hiring over the in the next period of 7,000 individuals, 2,000 to support visitation in long-term care and assisted living, 3,000 healthcare support workers, and approximately 2,000 more to fill existing vacancies. Approximately 1,284 FTEs have been hired to support visitation. So that's the first category of 2,000. In addition, 5,085 participants have entered the HCAP, that's the Healthcare Assistant Program participant pool after clearing preliminary checks. And since the middle of November, in addition to that, another 1,500 expressions of interest have been submitted, and the interest in the program continues to be high. I should say that on December 11, 2020, 2,527 HCSWs were allocated across 349 Phase 1 sites, including 101 early adopter sites, and hiring is complete for the early adopter sites, with 92% of the seats being filled. All of that is a significant effort to support not just senior services now, but into the future. I'd also note that in addition to the work that has been done in long-term care, PPE 完成了多少等等等等那么这次呢，他从各个角度给大家汇报了这个我们 BC 省公卫系统应对这个新冠病毒的这个准备情况。 at outbreak sites from the beginning of the pandemic, but in particular since November. This includes staff to support those sites. As you know, our long-term care system includes health authority owned and operated sites. That's about 3 out of every 10 publicly funded beds, and for-profit and not-for-profit public beds in other sites. That's the
那
majority
么
of beds.
同时呢，我们大陆
Certainly,
熟悉
there's
的
no
人呢，都是
distinguishment
说
between the
那
two.
个为什么不
Currently,
做
today,
这个方
as
舱
of
医院
yesterday, I
始
should
终
say,
是做个
from a
方舱医院。
snapshot,
其实呢，
about
北美的这个包
96
括欧洲
VCH
的
staff were
这
deployed to
个
outbreak
传
sites.
统
In
的
other
观
words,
念不
they
一样，就是
volunteered
理
to
念，
support
公卫
those
系统的
sites,
理念不
and
一样，所以
116
就
staff
没有
in
这个
Fraser
方
Health
舱
have
医院
done
的
the
概
same.
念。
I
去年的
wanna
3月份、
just
4月份
express my
，BC 省
appreciation
疫情最
to
严
them,
重、
to
最
the
严重的
families,
时
to
候
the
呢
residents in
，BC
long-term
省
care,
的是
in what
在
has been a very,
Canada
very
Place
challenging
做了
and
一些
difficult time.
2000
We
多个
know and
床
we've
还
known
是
from
多
the
少
beginning,
床
and that's？
这个
why
呢，
from
就
the
是把
beginning,
没
with
有
the single site
流
order,
行
the
病的，
decision
就是这
to
种平时
provide
的这种
PPE, even though
住院的
contractually
人
it's not
移
required
植到
when
这个
it was a
Canada
requirement
Place
of
不是
our
说让
providers
这
who
个
are
有新冠的
in
人
the
集中
private
到那边去
facilities for
这个完全
public
不一样的
beds.
概念。
They
所
were
以
included in
后
the
来呢
supply
也
chain.
就没有
All
用，
of
因
the
为
efforts at
几乎
infection
没有
control,
多少人
adding
去，
workers as
所以这
discussed
个
here, and
Canada
other
Place 的这
supports.
个
Because we
临时的医院
understand
呢，我
since
们叫暂定
visitation has
医
been
院，
limited
英文叫 Field
from March
Hospital，
and then
就没有用。
changed in July, but that is a primary place that communities with their significant
那么他也
community
刚才
outbreaks
就是
has
提
an
到了这个
impact
问题
on
不
healthcare
单单是
workers who are going in and working
Canada Place，
in
还有一
long-term
些
care.
社
You'll
区
see
也开辟了
when you review
临时的
today's
这个 Field
outbreak
Hospital。
reports that more than 600 people have passed away in long-term care.
那么它
And
有
that shows
这
the
个有600多
vulnerability
个
of
是
people
在
in
长期
long-term
护理院的
care
人
to
死亡
COVID-19. In
就是这
comparison,
个他们太
a
容易
much
受
smaller
到
number, I
病毒
think
攻
it's
击
less
了。
than
他说
50, have
这
passed
个
away at
是
assisted
在
living sites,
1038里边有
only
600多，其实是
less than
70%左
a
右。
handful have passed away at independent living sites, which tells you that
话
vulnerability
说回来，死
that
亡肯定是
people
不好
face
的
there,
但我们
very
稍微自我
significant
安慰一
challenges.
下
So we are
昨天是
appreciative of
7
all the
个，
work that's
前
being
天
done.
是
We
13个，我记
understand
得
from the beginning,
所
and that's
以
why
还是
we've
下降。
taken so many
至少
efforts and steps
从
over
上个
time
礼拜开
to
始
try and protect
好
long-term care
像
homes,
每
and
天
we'll
又
continue
回
to
到
do
了
that. Because
1
we
位
know
数。
that long-term care homes to be successful require people to go in and provide services directly to people, to provide those direct services to people in some of the most personal of ways, whether it's providing baths or helping people to the washroom or helping people to eat and providing care and
他也
sustenance
说
in
到了
many
就是
ways,
帮助
social
老
and
人
others.
洗澡
And so
洗
the
手
challenge for those workers is considerable,
帮
and
助
the
他们吃
challenge of
饭
keeping
等等，
long-term
这
care
些都
safe
是
is
长期护理
considerable.
院
And
的
I
一
am
个基本的
very
工作
appreciative
所
of
以
the
他
role
说
that
我们也
everybody's done
很感
and
激
everybody
这
in the
些
system's
员
done. And
工
I want to reach out
他
to
们
family members who
在这个
I've
疫情
spoken
期
to
间
from
特
the
别
beginning
困
of the
难，
pandemic
挑战
who
特
are
别大。
dealing with the circumstances that I know personally of being separated from loved ones often, and the
同时呢
anxiety，that
老年人
produces,
呢也是很
particularly
可
when a
怜
site where，
他
someone you
们
love
和所
is
亲爱的
involved in
亲
an outbreak
人
site.
子女呢
It
有
is a
有相
moment
隔，
that
不能在
nobody
一起。
who's been in those
所以他也
circumstances
是
will
说到
forget.
了这个
And we
老
think
年
about
人也
that,
是
we
付
work
出了
on
巨大
that
的努
every
力
single
巨
day.
大的牺牲。
Our work is not done. Whether in
他
our
说我们的
essential
工作远
services
没有
like
结
healthcare,
束。
transportation, food supply, pharmacy, or
我们
restaurants,
还要
or in our
不断
communities,
的完善
workplaces,
这
or
个交
households.
通
Our
运
work is
输
not done.
食物
For each of us,
包
no
括
matter
药
our
物
calling, no matter where we live in BC,
等等
no
等
matter
等因
all that
为
we've
长期
done
护
to
理
stop
院
the
都
spread
是
so
遍布在
far,
全省
our job
各
always,
个
our
社区
priority
里边
always, our
就像
focus
我这边
always,
住的
and
地
our
方
duty
有好
still
多个
is
长
to
期
stop
护
the
理院
spread,
所以我
to
们
use the
BC
skills
省
we've
好
learned,
像有
the
500
guidance
多
we've
个
been given,
700多
the
个长
masks
期
we are
还是
required to
500多个
wear, or other
所以
PPE
这个是
essential
很
to
多
our
的
work that we must use to stop the spread. We
所以
must
他说
each
我们一
stay
定要行动起
100%
来，
all
阻
in
止
our
病毒的
commitment to
传
stop
播
the spread.
让
Right
我们
now,
每一
we
个人
must
行
also
动起来
stay committed
这个承
to
诺
the
自己
tolerance,
所做的
kindness,
下定决
empathy,
心，
and
你既然
forgiveness
下定决心了，
that
你就
have
要做
made our
到。
BC fight uniquely our own. I agree entirely with the comments made by Dr. Henry today
他
with
说我
respect to
今天完
racism.
全
We
同意
must,
今天刚
at
才
this
Honey
time,
Bonnie
do
Henry 说
everything we
的
can
评
to
论
stop that
我们每个人
pandemic
必须
too.
行动起
And
来，
we
是
must
每个人的
continue
工
to
作职
deliver
责
those
来阻
qualities,
止
the
病
ones
毒
that
的
we are
传
so
播。
proud of to each
我们
other
必
and
须
to
只能
ourselves.
是继
In
续
doing
的
that,
相互
we'll
支
make the
持
future。we've
我
been
们也
working
很自豪，
towards
我
a
们
better
已
one.
经
Now
过去
more
已
than
经
ever,
完成
and with
顺利
more
的
of us
让这
now
个
than
曲
ever
线
before,
拉低
we
过
must
啊。
stop
我
the
们
spread.
能做到，
Aujourd'hui, nous
所以我们
annonçons
现在还是要行动起来，阻
537
止病
nouveaux
毒的
cas
传
qui
播
ont。testé positif pour
现在又说法
COVID-19
语
pour
了
un。total de
今天的卫生厅
59
长
cas
话
en
好像
Colombie
多了一点，
britannique. Nous sommes attristés
两个人说了已
d'annoncer
经
7
25
nouveaux
分钟
décès
了，好像
liés au
原来没有
COVID-19
那么多。
pour un total de 1038 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont
那
perdu
么
leurs proches
我再
durant
给大
cette
家重
pandémie.
复一下，在过去
Parmi
的
l'ensemble
24小
des
时
cas
里边，
confirmés de COVID-19,
新增了
532
536
personnes
个
sont，
我们
actuellement
BC 省总
hospitalisées
数
dans
就到了
74 en soins
59,608例。
intensifs.
其
Merci
中呢，
beaucoup. Thank you very
啊，
much.
那么又
We're
要
happy
我
to
本来
take your
想说
questions.
各个卫生局的新增的分布，因为我
Thank you,
都记下
Minister.
来
As a
了。
reminder to everybody on
那
the
么
phone,
现在
please
就
press
是
star 1 to
记
enter
者
the
的
queue.
提问
You are
时间。
limited to one question and
有
one
些记
follow-up
者问
only.
的呢，他们
Please
是
also
反
take your
复
phones
去
off mute.
说了，
You're
有
not
些记者
audible
还在
until
问
I call your
啊。
name.
当然，提
First
问
question
记者
today
无
is
冕
from
之
Mary
王，
Griffin,
他们
Check
提
News.
问是他们必须的啊，这是他们
Oh,
的职责。
hi. Thanks so much for taking my question, Dr. Henry and Minister Dix. I'm just wondering if you have any reaction to the Premier musing today about seeking legal advice on prohibiting interprovincial travel into British Columbia.
啊，那么他说，今天
Sure,
省
this
长
is
早上
something
说
that
了，
has
就是
come up
国
as
去
an
旅行回
issue
来，有些人违反禁
starting way
令
back in
啊，那么
March,
我们
and
能
you
不能
will
考虑
recall
到
that
一
we
些
were
这个
one
法
of the
律的
first
惩
provinces who
罚
was
的
calling
措施
for？
他说我们
border
3月份
measures
其实
from
已经
international borders,
特
and
别
we
是
still
3月份以后
need
啊
to make sure
这
that
个
those
国际旅
are
行的
strengthened.
这个
We know there's been challenges, and
我
we
们
see
知道
that
这
with
方面呢
the new
也
variants
是
that
很
we've
困难，
been
也有挑战啊，这些人的
been
规范
following
啊，
lately.
因为
It's
病毒
also
的
been a
变异
challenge
很
to
多。
try and ensure that we have measures
那么同
that
时呢，我
support
们也有
people
很多的
here
措
in
施
BC.
来
And
支持大
early
家
on, we talked
啊，我们
about
其实
having
很早就有这个些
parks
措施
available for BC
包
only, and
括
through the
BC
summer,
的公园
that was our
局
promotion
啊，
to
特别
stay
整个
local.
如何
And
在
we
度
do have
过夏天
requirements that people who
我
come
们也
into
有
British Columbia
对
must
这个
follow the
来
rules
我
that
们
are in
省的
place
人
here.
有一个
And that is
特
something
别
that
的
is
要求。
continuing to be reinforced. We, at my level, as well as I understand at the Premier's
那
level,
么从
have
我
been
这个层
talking
面来
with our
讲呢，
colleagues across the
我
country about
我
the
们
need
这
to
个
try
包括
and
联邦
stay
这个
put
城市
unless there's
啊，
essential reasons
联
for
邦这一
travel
级都是在
interprovincially as
努力
well.
不断的努力
Those are important
包
considerations
括
right
省和
now.
省之间的
I do not
旅
feel
行
I have the
移
authority
动
to do
都
those
做了一些
types of
额外
actions, and
的
we're
措
looking
施
at
和
what
限
types
制
of。actions may be needed, and is there other ways that we can ensure that people in British Columbia are protected from people coming from other places who might bring risk with them. Having said that, I know that there are many people who are still concerned about license plates and seeing
那么他也
people
是
who
说
have
到
come
了，大
from
家可能还是在
other
在路上
places.
很多
And
其
we
他
must
省
remember,
的
as
这个
always, we don't
就是牌
always
照
know
啊，有
everybody's
点
story.
担忧。
And there
那
are
么
many
他
people
其
who
实
have
说
come
实
here
话，
who've been
他已
here
经
for
解释了
months
很
or
多次
weeks,
了。他说很多
and
人
who
就
have
算
the
是
same
这个
risk
阿省
that
的
we
或者是
have.
美国的牌
And
照，
for
其实
all
他
of
们
us
在这
here
儿已经
in
待了
British
数月了。
Columbia, it's important
很
for
多
us
人
to
是这种情
continue
况，
to stay
不是说
local,
他们今天来
to
的。
reduce our travel, to reduce
所以，
our
但是我
social
们希望大家
interactions
还是就
unless
是
it's
减少
essential.
旅行不必要的旅
Do you
行，
follow up,
减少人和人之间的接触
I do.
减
Thanks so
少
much,
这个
Lindsay. I was
大
just
家聚集
wondering,
的
would
人
you
数
be。in favor of quarantining? So if someone is coming here for non-essential reasons, they would have to go through a mandatory 2-week quarantine. And would you, right now it's a recommendation for non-essential travel, but is there a consideration to make that a public order, no essential travel?
We have not considered making that an order for a whole variety of reasons that we've talked through many times. There are many different interpretations of what essential travel is.
那么他也说到了，就是对这个基础旅行的定义，很多人理解不一样，所以我们没有办法做一个统一的
And we
命
need to
令，卫生命
reinforce, and
令。
there's other ways of
那
trying
么
to
你怎么说这个是非
reinforce
必要旅行呢？对
what
吧？
essential
所以他
actually
说每个人
is
的理
for
解不一
people.
样，
So no, I'm
定义
not
也不一样。
considering doing a public
所以
health
我们不
order
会从这个
around
角度，从这个
requirements
公
around
卫系
travel,
统的角度去
either
发布命令。
interprovincially or in BC. There are options, as we've seen in some of the communities in the Yukon, for example, and of course the Atlantic
那么他也是
provinces,
说到了
where
Yukon
a
这个
strict
城市，
quarantine
他
is
们自己有
maintained.
自己的这个
In discussions with
特殊的
the
要
many
求
people that
啊。
we make these decisions with,
因为
it's
大家都有
hard to
自己
see
的
how
决
that
定
is feasible
如
in
何
British Columbia
有
for
些
many
措施是
reasons. Our
可
borders are
行执
very
行的，有
different.
些是不
We
能
have
执
many
行的
ways that people
那
can
大家都
cross,
是自己根据
particularly
自
from
己的情
Alberta.
况。
And we know that there are many services and work places that people live in one or the other province and move back and forth for reasons of work and other things, including medical services that people receive in different parts in different provinces. So it is a very challenging one for us. We don't have those simple borders. My home province of Prince Edward Island, when there's only 2 ways to get in, it's much easier to be able to monitor that type of travel. So not as easy for us in British Columbia.
所以这个对我们 BC 省来讲也不是件容易的事情，所以卫生厅长也做一些补充。
I want to emphasize just first of all that it doesn't just apply to people coming from Alberta to British Columbia or coming from Ontario or Quebec to British Columbia, but this applies to British Columbians traveling there, that we have an obligation as well not to engage in non-essential travel to other provinces. This is a message I know health ministers in provinces are delivering everywhere, and I think it's an important message. There are a number of ways of looking at it. The Premier made it clear today that this is a serious
那么华人的家长，你知道的，从来不会放心的，所以一定会陪着去。那你说这个算这个非必要旅行吗？所以 Dr. Bonnie Henry 说了，非必要的旅行，每个人的想法、定义的不一样，这个都能理解。我个人觉得能理解。不要是说因为跟我没关系，或者是我不会搭建，所以我就坚决反对。所以这个他们作为公卫系统的工作人员以及这个政府的决策人员，一定要想到这些问题。那么他这个已经说到了，就是大家自觉了。说实话，苦口婆心，也就是说尽量避免非必要的旅行。包括了滑雪，他刚才说到了啊。所以他说现在是真的是不要再做了啊！就算是疫苗来了，疫苗还不够啊，对吧？所以这个时候特别，哎呀，不要说哎呀有疫苗了，我们就放松吧，这个是不对的。疫苗也不是人人打，现在才打到昨天为止才打了69000多个人。
Oh, hi, thank you very much. Dr. Henry, I just want to go back to something the minister raised, was the interior number, the biggest case number, I think, since the pandemic began there. And that's where the biggest growth of active cases are. Fraser's declining, Vancouver Coastal is declining. Interior is now ahead of Vancouver Coastal in terms of numbers. To what do you attribute that? Is it improper gathering during the holiday season? It is 14 days.
Yeah, and that is certainly one of the big components that we're seeing in a number of communities across the interior. So it's not focused in one area. We saw that in the summer where there's a lot of focus on people holidaying. What we're seeing is more local, where people had come together in small groups, had decided that they could stretch those rules, and we're seeing transmission in small clusters that is moving through communities, and it's very challenging because it's not related to large events that we were seeing before. It's related to people thinking it's okay if it's just a few of us, and unfortunately it is spreading in all communities now. We have seen some very severe outbreaks, and certainly in the couple of First Nations communities, in Revelstoke, in Big White, of course, we know that is ongoing. So now in the interior, we are seeing the implications of what could happen in this province if we had all taken those liberties a few weeks ago. But it is absolutely reflective of people getting together over the holiday season, and that is now putting at risk our long-term care homes, is putting schools in a more tenuous position. We can get through this. We can overcome that surge by people paying attention now and going back to not having those social gatherings, making sure you're staying with your household, monitoring yourself for symptoms, get tested, and stay away from others if you're feeling unwell.
No, I'm good. Thank you very much.
Thank you very much. Next question's from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I wanted to follow up on something that I asked about yesterday regarding long-term care, and specifically about the outbreak that was declared at Little Mountain Place
Little Mountain Place 上次他提了礼拜一，Little Mountain Place 也是一个长期护理院，死亡的人特别多啊。他说11月22号那一天也是有很多是测试成阳性啊。他可能，我觉得这个就是记者的责任，他就是要针对具体的问题要去盘根错节的问下去，追根到底。
It could be more than one case before an outbreak is declared. And from what I understand, what your directives have been for several months now, it's that if there's one case in a care home, whether it's a staff member or a resident, that qualifies as an outbreak.
那么他也是说到了，就是根据Bonnie Henry 的定义，只要是长期护理院里边，不管是职员还是住家，只要有一例是阳性，就是宣布这个地方是爆发。那么他说再重复一下，是的啊，
exposures in the facility, so the person wasn't in the facility when they were infectious to others, or weren't wearing PPE, then it may not be declared an outbreak. It may be.
那么他说。这个暴露又不一样，如果这个人他是有传染性到了那边去，但是呢又没有穿防护服啊，他又走了，也有引起那边的阳性，没有传染，这个就不算爆发，所以这个还是不一样。但是我们要加强那边的监视以及监控，所以我们还要不断的这个检查那边的住家居民。
From a staff perspective, whether there was any potential exposure within the facility.
所以他说，主要是从这个职员来讲，也要看清楚我有没有这个潜在的暴露的风险。
But there has been no change in that. We are thinking about how are we going to manage things now that we have people immunized and protected, and what that means. But we have not yet changed. We have not made any changes to the policy.
都没有变，这些政策都没有变，这些做法也没有变。
And it's still about Little Mountain Place. I spoke with Isabel McKenzie, Seniors Advocate, yesterday, and she still seems to be pushing for more testing in healthcare homes. Even if it's just twice a week, so that something like what happened at Little Mountain Place doesn't happen again. If we knew that a staff member had tested positive November 20th, and a resident didn't test positive until November 22nd, if everybody had been tested in between those 2 days, there's a chance we wouldn't have seen 41 people dying. So is it because there's not a lot of labs availability to test everybody, or like what is the reason for not conducting more tests of healthcare workers?
Yeah, so I think there's a couple of things there. One is it takes time for tests to come back, and so that time frame of a day or two, the fact that testing was being initiated on staff and residents because of the indicator that they saw is the appropriate response that we would have. There is a lot of testing that is done, especially when there's any concerns in healthcare workers. And yes, I think it's much more feasible to think about having healthcare workers go to a testing site periodically to be tested, and that's something that we looked at in some detail. That's being done in Ontario still. It's being done, was done in Alberta for a short period of time. The challenge is that it's not, it's very low yield, and it's challenging to do. The testing that was previously being proposed by a number of people, including the seniors representative, about doing rapid testing on site on a daily basis, I think is something that is just not feasible with the tests that we have. And our focus has been instead on making sure we have the resources to ensure staffing, particularly if an outbreak has been identified. When an outbreak is identified, testing is done, and it's the gold standard testing using PCR testing that's done in the home of all staff and all residents. So it is an iterative process. We are trying to learn from each of the facility outbreaks that we've had. We've been, my colleagues in public health and the outbreak response teams spend a lot of time trying to understand what is the best way that we can do. Testing is part of it, absolutely, and has been from the beginning, and we've been trying many different types of testing to see if it can make a difference. We have been, from the very beginning, doing everything we can think of to try and reduce the risk in care homes, and that will become very apparent. I know the seniors representative is going to be looking at Little Mountain in some more detail, which is always something that we welcome. And these are just very, very challenging outbreaks to manage.
Jane Side, North Shore News.
Hello. My question kind of carries on from what was being asked earlier about the interior. But I guess I'm wondering more in terms of the province as a whole, especially in Vancouver Coastal Health and Fraser. Where are the current cases coming from? Are those groups of a couple people getting together? Are they
是不是他们因为是人员聚集，还是或者是宗教啊，或者是上班啊，或者是人员聚集啊，或者是怎么样啊？能不能分析一下
？All of the above except gyms and
包括他说这个锻炼房等等。
Carefully, and since we put in the additional restrictions and the number of places, we're not seeing transmission in those places. We very rarely see transmission in restaurants when the safety precautions are being followed appropriately in restaurants. What we have seen is absolutely workplaces where we've seen quite large clusters in workplaces sometimes, and it's the workers, it's not the interaction with the public. It's the people having lunch together or in the break rooms or working in, we've had a couple of large outbreaks in food processing plants and some light industrial, some of the packaging and shipping, whether it's Amazon or Canada Post, where people are working in warehouses, but they have their breaks together in a room where they're eating and talking together or they're carpooling together. And then we know as well, particularly in the interior, it's been related to shared accommodations, young people, it's a higher proportion of younger people who are being infected and passing it on, and inadvertently passing it on through smaller groups to families and others. So it is one of those, again, where it's a whole variety of smaller settings now, with some larger workplace settings and some larger outbreaks in communities, but also related to, like we saw at Big Lake, for example.
Do you have a follow-up, Jane?
I do have another question. It's on the topic of vaccines. If you have received the vaccine, and presumably when it takes effect, you can't actually become infected with COVID, is it possible for you to transmit it even if you aren't yourself infected? That's a question that has come up, and I don't know the answer to it. I'm curious.
So a little bit of if you're not infected, you can't transmit it because you don't have the virus. But what we don't yet know is whether the vaccine prevents you from being infected. So being infected means the virus is in your body, and you may not be showing symptoms. We do know that the vaccines that we have, the Pfizer and the Moderna vaccines, are very effective at preventing symptoms, especially severe symptoms, and preventing people from hospitalization and dying from COVID. What we don't yet know is if it prevents you from getting infected at all. So that's why right now it's still really important that everybody continues to wear masks, to clean their hands regularly, to take those measures that we know prevent transmission of droplets between people. We do know that people who are asymptomatic or who have very minimal symptoms, who don't recognize that they're infected, actually don't transmit as well as people who are in the first part of their illness. So that's one thing. There are some evidence from the Moderna vaccine, the way they did the clinical trials, is they tested people before they got their second dose to see if there were people who had asymptomatic infection. And the difference between people who had the vaccine versus the placebo showed that it looked like it probably protects against infection, which means you wouldn't be able to pass it on to other people. But we still don't know that for sure, and the data is being collected. Those clinical trials are going on for 2 years. They're following people. And as well, now that the vaccine is being used in millions of people around the world, Israel is one of the first out of the gate, and it's almost like a nice little clinical trial in its own. Our test case where we can monitor people very easily. So we're looking at the data that's coming out of the UK, that's coming out of Israel, that's coming out of Canada, the US, to get better ideas about that. We also don't know how long protection from the vaccine lasts, but from the studies that have been done, it's at least 3 to 4 months, which is good news. So all of those questions are still a little bit up in the air.
或者是我们的希望是1年或者2年更长。
Dr. Henry, I'm just wondering if any more thought has been given on how to prioritize the waiting lists for the vaccination clinic.
那么也是说到疫苗，你们有没有这个优先次序优化一下？有特别是这个有些在医院里边上班的人。
i.e. will nurses or long-term care staff be prioritized over porters or other people who may not have face-to-face interaction with patients or high-risk individuals?
尤其是这些有些职员，他不是跟病人面对面打交道接触的，
clinics that we're running now,
或者呢是高风险的人，这个
the idea
诊所里
is,
边
and
的
I
人。
know all of the clinics are working on that to make sure that there are people at risk who are there to receive vaccine and to fill in if there's vacancies or
那么他也
end
是
of
说
the
到了，
day.
就是是的，
Having
因为
said
有些打针
that,
计划好的人没打的话，不是有空了吗？ 那么会提上去，会填空。 那么是有这个有效机制，
yes,
有
when
这
we
个
have
考
more
虑。
vaccine, that's going to be a higher priority. And there are many
那么
stories
同
that
时呢，
we've
这些
heard
人也是优先考虑
that I
的，
have
他们是
heard
在清
about
单
people
的
who
最上面。
have made that extra effort to go out and find somebody who's in the high-risk category, whether it's an alternate level of care patient who's in the hospital or whether it's somebody who's working in the ICU who hasn't got their vaccine yet. So people are doing the right thing for the most part, and I think we need to celebrate that, the fact that we have not wasted vaccine
到
and
目
that
前
we're
为止，
getting
大
it
家
into
做的
those
还都
people
比较
most
好
at risk.
疫苗没有浪费掉，
Richard?
疫苗没有浪费掉，因为这个疫苗拿出来就要打，据说是6个月，6小时之内要打掉。
to ensure that the right people are
那么
getting
你
the
们有没有更
vaccine,
加的好的
especially if
措
there are
施，能够
cancellations
保
which
证
are
那大
expected,
家
and we may have
做
like
所有的
large
次序
groups
都
of
做得
people
好。
also
那么同时
coming
呢，
on
如果
board
有
at the
人
same
打来
time in
临
terms
时
of
取
priority.
消，如何去避免这个浪费，
Well,
让人家来候
that's
选
the
来
work
打
that Dr. Valum is going to solve for us all by next week.
Dr. Valum, 很有意
we've
思
been
啊
thinking
，Dr.
about this
Valum。
quite a lot. How do we make
他
it
说我们
fair
其实也有
for
很多
people?
考量，
The group that we're thinking about most urgently is we know that we want to provide vaccine to people over the age of 80 who live in the community,
那么
so
同时
who
我
aren't
们的
in the
优先
long-term
次序
care
就
where
是
we're
80岁
focusing
以
right
上
now.
的社区
How do
的
we do
老人。
that? How do we do that in a way that
那么
makes
他们
sure
不是
that
在长期
everybody
护理院
is
的，
contacted,
我
knows
们也
where
会
to go, doesn't have to
我们
stand for
会联
hours
系
in the
他们，
rain
我
as
们的
we've
护士
seen
会上门
in some places,
等等，或
other
者是让
places.
他们
So we
我
are
们不希
working
望
on
他
that.
们
We
或
have
者
some
等几
great
个小时，结
ideas
果是
that are
白
coming
等。
together, and we'll be providing more data and more, well, not more data, but more
我这个记者
absolute
问的真的
information
是好
about that next week.
本来今天打10个人，结果有1个人没
We have
来
time for one more
啊，
question
那么
for
好了，
everyone
1个人
listening.
没
Dr.
来，这
Henry
个
and
疫症
Minister
就
Dix
浪
will
费了。
release a
但
statement
是
this
从
afternoon with the
Bonnie Henry 的
latest
说法，就
information
到
on
现在为
cases,
止没有浪费。
hospitalizations, and outbreaks,
最后
which
一个
you
问
can
题
find
了。
at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Susie De Silva, CBC.
Thank you very much. You mentioned about the South African variant, that if contact tracing hasn't yet turned up, a connection to travel for that person who has that variant, and I believe you went to say that you don't believe it has spread in the community. How can you be confident in saying that if you still don't know where it has come from?
Well, we don't know how that person got it yet, but I'm confident there's not spread from that person to others. So, yes, thanks for making that clear. It is a challenge. We don't know. I have some confidence. Well, I have quite a bit of confidence from our lab and the testing that we're doing that it's not widespread. We're not seeing lots of that variant showing up in the whole genome sequencing that we're doing. We're trying to do it in a systematic way to test randomly in the community, to test more of the sequences from areas where we know there have been people who've traveled who've had the variant. So we are coming up with another strategy, a broader strategy to see how we can even do better at that, looking at things like wastewater and other things. But right now, we don't believe that either of those variants are causing a lot of spread of illness in our communities yet, but we are not by any means out of the woods. So it may be that we're in a very similar place than we were in February of last year, where we have importations, and if we can find them and catch them early, we can prevent that variant from spreading. But it is, of course, a concern, and we're continuing to monitor.
Susie, do you have a follow-up?
Yeah, I know you just mentioned there about the challenges and looking at changing things. Can you give a sense in terms of how many of these types of tests are being done? Like what percentage of the cases that come back are actually being checked to see if they have the variants? And is this your biggest concern? And BC's been holding the line recently, especially in comparison with elsewhere, that this could be a game changer if it does begin to spread widely here?
Yeah, I think, we're in that bit of a race right now between how much vaccine we have and how much transmission in our community, and this is why it's so important. The one thing we know about these variants is they are still amenable. They still spread from person to person in the same way. And the things that we do to stop the spread work. So that's why we're so focused on the things that we need to do now. So that's really important. We have all along been doing sampling, either in outbreaks, in situations where we see unusual transmission patterns, and random samples of about 5% of all of our sequences, all of our genomes that are the isolates that we've had across the board since the very beginning, and that's about the same percentage as the UK was doing when they picked up their variant. So I'm fairly confident that if we were seeing a lot of spread from one of these new variants, we would have picked that up. But it does show us that we are connected. What happens in the UK comes here, and it's just a matter of time. Same with South Africa. So, and most recently today, there was some concern about another variant with some similar differences in the stock protein, or the spike protein from Columbus, Ohio, and whether we're going to see that one here. So it is a challenging thing to look for those. We do a fair amount here. We've got a good program. We're doing it in collaboration with the National Microbiology Lab. And so we can have some confidence. Obviously, right now, with the concern that we're seeing, we want to step that up. And we want to remind everybody of how important it is that we know what to do to stop the spread. And we need to keep doing it because an end is in sight. And we need to get there.
那么他又说法语了。好，我把今天的数字再给大家重复一下。昨天新增了536例，我们 BC 省总数到了59608例，其中延安卫生局新增了102例，飞沙卫生局新增了253例，岛上卫生局新增了21例，内陆卫生局新增了115例，北部卫生局新增了45例。住院应该是352例，其中这个重症监护是74个。过去24小时里边呢，很遗憾死亡了7例。那么 BC 省到目前为止与新冠相关的死亡不一定是死于新冠，所以我们这个中文的语音表述真的有时候就说是死于新冠，其实英文里边说的是COVID-19 related death 相关，不是直接死于。这个中国的定义是直接死于这个完全不一样的。那跟新冠相关的死亡呢，到目前为止是1038例。那到昨天为止，今天又多了一个，每天多了一个更新的数字，就是接种施打的这个疫苗是69746个人。这个礼拜一是59002人，那么3天里边也就是打了1万人。但是现在货源来了，希望会越来越多。
Merci, thank you.
好 ，Merci。礼拜一大家再会。那么这个是我们的卫生厅长我同时也是给大家说一下 我们下星期再会了。网友们祝大家安全，过个愉快的周末，下周一再会。